Thanks, everybody. I think it's just about 4 o'clock. My name is Jose Avila. I'm the chairperson of the Board of Health for Oak Creek. And seeing as we do have a quorum for the meeting, I would like to call the meeting to order and start with a roll call. Again, my name is Jose Avila.
Steve Kurkowski's here.
Denise Decker.
Rick Bearable.
Gary Pittman. Dale Pittman.
And Darcy Du Bois.
Great. Thank you so much, everybody, and welcome again. And we
need
got
to
an
do roll call if there are any guests.
Oh, excuse me. Thank you so much. Any guests in on the meeting at this time? Please state your name. Someone joined by phone. If you could state your name, let us know who you are,
phone
please.
number ending in
Rosemary
3216.
Say again, please, ma'am.
Rosemary Annenson.
Thank you.
Thank you.
Alrighty. Okay, so having done the roll call, again, approval of the minutes. Darcy, are we going to show them, or do everyone should have copies of them?
Yep, I'll share my screen and pull them up just out of ease, but I did email them. I know it's a little tricky to manage a bunch of stuff at once on your one screen. So let me find them. Here they are. Okay. Here are the minutes from March 5th. Can you see those?
Yes.
Yes.
Yeah.
Okay.
Okay, so if all the members would review the minutes, please, any comments or anything? I know you did receive them by email, but any comments or suggestions or corrections to the minutes at this time from anyone?
Nope.
No?
No.
If there's no correction to the minutes, could I have a motion to approve the minutes as written?
I make a motion
Second.
to approve minutes as
Thank
written.
you, Rick. A second?
Second it, Gary.
Gary, thank you. All in favor, please say aye.
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 Opposed? Opposed or abstentions? Okay, great. Next thing on the agenda is our health department updates, our health officer report. Darcy?
So I did not open the report. I can.
It's fine. That's fine. We should have
It's
received
very
it all.
short. So, basically the report was just about our COVID activities. So, we have been, since the middle of March, really all health department resources have been directed at COVID response. So you can see from the report, that's basically what I said. And then I will pull up our data here and you can see that, our communicable disease investigations and contact investigation numbers are very high. And the rest of our numbers are quite low, just because we are focusing all of our resources on COVID-19 response. So are there any questions? Otherwise, I was going to jump in, but I was going to provide, some more comprehensive information kind of about the work that we've been doing with COVID.
Darcy, I would like to note that Dr. D'Amico did join the meeting
Oh, thank you.
at this time.
Thank you.
Please go ahead.
Okay. So as of today, we have 97 positive cases of COVID here among Oak Creek residents. We've had 564 residents test negative. We've had 53 residents who have been released from isolation, and we consider them to be recovered because their symptoms have resolved. And we've had 11 deaths among Oak Creek residents.
Oh.
So we have seen in Oak Creek about 15% of residents who are being tested have tested positive. In Milwaukee County, there are nearly 3,600 positive cases, over 18,800 negative cases, 2,004 individuals recovered, and 212 deaths. And across the state, as of today, there were over 9,200 positive cases, over 93,000 negative test results, 4,500 people recovered, and 374 deaths. So I wanted to go back to that where I mentioned that we are seeing in Oak Creek about 15% of residents who are tested are testing positive. That's similar to Milwaukee County, which is 16%, although across the state, 9% of residents are testing positive. What we know is that we want to get that number to a lower percentage of residents testing positive. Ideally, we're aiming for between 5 and 10% of tests should have positive results. That's a good indicator that we're testing enough people. We want to make sure that there's enough access to testing and that enough individuals are getting tested so that we have a good idea of the actual disease rates in the community, and so that we are making contact with as many sick individuals as possible to make sure that they are isolating in their homes and that we're doing contact tracing and notifying their contacts. So that's a number that we are paying attention to. We've been working with the healthcare systems and the federally qualified health centers. They are the ones who have been ramping up the testing, the access to testing in the Milwaukee area. The health departments, we just don't have the resources to do the testing. So we are, after some delay and after a lot of work, we are starting to see increased access to testing. So most of the healthcare centers are now testing all individuals who are symptomatic. The federally qualified health centers, which is like 16th Street, Gerald Ignace, Milwaukee Health Center, Milwaukee Health Services, rather. I'm not saying all of them, but those are federally qualified health centers. They are also doing testing of all individuals, whether they are established or not with their clinics. And we have received word from the state that they'll be using the National Guard to stand up 2 testing centers, one on the north side and one on the south side of the city of Milwaukee, I believe next week. And that testing will be available to all individuals, whether they're symptomatic or asymptomatic. So we are seeing some positive steps to increase testing, and that is a really important step towards starting the phased reopening of businesses and the economy. I wanted to share some additional data. So this is a graph that shows each day since we got our first positive test, which was March 13th, or our first, test result, which was March 13th through the end of April. This is the number of test results that we're receiving each day. The green part of the bar is the positive test and the blue is the negative test. So you can see that, it does seem that the number of test results overall that we're receiving has been slowly increasing, which is a good sign. We want to see more people getting tested because we had been hearing from a long time from residents that they were having a lot of trouble getting tested. We have noticed that the number of positive test results coming in seems to be slowing down, which is also a good sign. We're seeing more negative test results, and that's exactly what we want to see. So we're hopeful that those trends will continue. I'm just going to scroll down to the next graph. So this graph shows the percent of positive cases by age group among Oak Creek residents. So you can see that we have the highest percentage of cases in individuals aged 50 to 59 and 60 through 69, which is not a surprise, given what we've heard about the way that the disease impacts different age groups. I'm going to keep scrolling. This is just a graph that shows positive cases by gender. So we're pretty evenly split here in Oak Creek between male and females testing positive. And then finally, this graph shows positive cases by both race and ethnicity. So the first 4 bars are self-reported races from clients. You can see the majority of cases are among white individuals here in Oak Creek, followed by 13% of cases among Black individuals, 6% Asian, and 6% other. And the last 2 bars are Hispanic and non-Hispanic. You can see that the majority self-report is non-Hispanic.
Darcy,
Sure, yep.
what is non-Hispanic?
That just means someone who does not have a Hispanic ethnicity. It has Hispanic or Latino ethnicity. So,
wouldn't that be white, Black, Asians?
So a person could be both white and Hispanic, or Black and Hispanic, or non-Hispanic, depending on their ethnic and racial makeup. So they could be, for example, from a Hispanic country, which we would say like Puerto Rico, for example, but they might also report as Black for their race. They're 2 different indicators that the federal government uses, 2 different indicator categories.
Yeah, so for example, myself, I would be considered white Hispanic. This is Jose Avila again. And it is confusing for the many years when you fill out applications. Okay, I'm not black, I'm not
Right.
white, I'm Hispanic, but technically we're white Hispanic. And Steve, you would be white non-Hispanic.
Then I'm in two categories then.
Right, so these are actually,
Right.
I was just, trying to make one instead of two graphs. If I was being more comprehensive, I would have two separate graphs. One would be race and one would be ethnicity. And I did have a bar right here between other and Hispanic that kind of showed they were two different categories, but somehow that got deleted when I saved it as a PDF. So I apologize. I know this is confusing.
Yeah, it is a little misleading, I think, because
It is.
I'm either white or I'm non-Hispanic, I mean,
Right.
I'm
You would
really-
appear on both graphs if there were two graphs. So I apologize for that confusion. I didn't notice my divider was gone
Okay.
until right now. So some additional information just about what we're seeing here among positive cases here in Oak Creek. We've seen 16% of Oak Creek residents who have tested positive are healthcare workers. So that's not necessarily that they work in an Oak Creek facility, but they work in a healthcare facility somewhere and they live here in Oak Creek and have tested positive. 34% of Oak Creek residents have tested positive, have been hospitalized at some point during their illness. And 58% of our positive cases are associated with an outbreak in a facility. So that could be a workplace, a healthcare setting, or a long-term care facility. Those are the three types of outbreaks that we're seeing people connected to. So 58%, that's the majority of our cases, are connected to some sort of outbreak, meaning that we're seeing more than one case in those places.
Darcy, can I ask a question? This is Jose again. For the healthcare providers that are positive, when the data is reported, is it reported where they think they were infected, or is it reported where they live as a statistic?
Where they live.
Where they live. Okay, thank you.
Yep. So as far as the health department workflow, like I mentioned earlier, we have been dedicating all of our resources to COVID response, and we're overwhelmed by the amount of work. So we have been fortunate to bring on 6 additional temporary staff. So we've partnered with the school district, and their 2 school nurses who weren't needed in the schools once the school shut down have been working here in the health department part-time, which we really appreciate. We also have 3 of the library staff. Again, the library was closed in mid-March, and so 3 of their staff have been here helping us. And then we also have a management intern that was reassigned to the health department temporarily. And so those 6 staff, they're all part-time, but we have been surviving thanks to their help, and we are very grateful for them. Our staff have been working 7 days a week since this started, so any help is really appreciated. I am participating daily in calls with the other Milwaukee County health officers and the state health department. And that's really, we're trying to facilitate collaboration and information sharing, especially here in the county. We know that our borders are so fluid that we're really trying to work together and have a unified message and a unified response as much as we can. We're also spending a lot of time working with our community partners and community different entities in our community, both to help try to prevent disease and to mitigate the spread of disease if it does enter those facilities. So, we worked early on a lot with the school districts and the private schools and MATC. They are closed now, but we still remain in communication, kind of talking about their plans and what they're doing. We've been working closely with our healthcare centers here in Oak Creek to make sure that we're sharing information that we have and that we understand what they're doing. We've also been working with childcare centers to make sure that they have the information that they need to operate safely. We're working with all of our long-term care facilities to provide information and guidance and help them access personal protective equipment, the PPE we keep hearing about. And we're working with many Oak Creek businesses, sometimes just because they have questions and they want to know if they have implemented the right type of preventive measures or mitigation activities, sometimes because they have an employee who's tested positive, and we're working through what that means for a business and how they continue to operate safely. And we are starting with all of these groups to plan for the phased reopening that's coming. So making sure that they are ready with, as we see things start to reopen, we know they'll look a little bit differently as far as, how people are physically distancing, or what type of equipment or cleaning supplies or hand sanitizer or things like that that they might need to have. So we've started a lot of those conversations to provide resources and just think through how that will look and what they will need once they're reopened or once they're expanding from what they've been doing. Does anybody have any questions?
I do. This is Denise. I just wanted to ask, since the expectation is that the virus is going to be around for a while, are you guys going to be able to keep those 6 people that are helping you out?
I hope so. So the school nurses will be available through the end of the school year, which is about a month from now. And then because they don't work in the summer, they won't be available over the summer. The library staff and the management intern who is helping will continue to be available. And we've been having I've already talked with our administration and about the possibility of, reassigning some additional library staff or staff from another department who might be able to help us out temporarily. So definitely it's on my radar to make sure that we continue to have that support, because we'd be really struggling without it.
Okay.
Darcy,
Darcy, this is Steve. The recent ordinance change that allowed the police department to go out and assist you with any type of enforcement. Has there been any enforcement of the stay-at-home order in Oak Creek? And if so, do you have any feedback or statistics from that?
Yeah, good question. So there has not been any enforcement as far as issuing a citation or making an arrest, but the police have been following up as they have been receiving complaints as it's appropriate. So, we early on, kind of after the safer at home order was issued, there were some complaints about businesses that were operating that maybe shouldn't have been. So they had a light duty officer who was helping with that, making those phone calls. And it really has just been informational. So talking to the manager or explaining what the requirements are. I think that Chief Anderson mentioned there's been a couple of complaints, sometimes, especially when the weather is nice, about groups congregating, maybe playing basketball at a park, or a large group of people. And again, they've just been sending an officer out just to have a conversation. It hasn't needed to go any further than that.
Okay, yeah. Bel Air Cantina had an event on Tuesday for Cinco de Mayo, and they had quite a number of people outside. That was a rather festive atmosphere, and so I don't know if there was any follow-up with them or not.
I did hear that, and I believe that the police did go over there and at least talk with the manager, but I did hear that it was quite busy.
Yeah. Okay, thanks.
Darcy, just Jose again, just a couple of questions. When you talked about opening up testing sites on the south side of Milwaukee that anyone can access, will they need a referral for testing? Do you know?
Good question. My understanding is that they will not. We don't have all of the details yet, but what we have been told is that it will be essentially drive-up testing, first comes, first serve, no appointments needed, no referrals needed, and no requirement to have or use your health insurance.
Do they know where the site's going to be yet?
I don't know that yet.
Okay.
So we're hoping to hear that. As soon as we hear it, we will be, actually, and I didn't mention this in my information, but so we've been sharing information daily on social media. So if any of you are on Facebook, we post a daily update with the number of cases and things like that, and other relevant updates. So as soon as we get that information, we will be sharing it on our social media as well as across the city, the social media platforms.
Another question I had is, I know that the federal government is thinking about, again, a third, whatever you call it, package of money coming out, and they're looking at helping the state and local communities provide funding. Would the city of Oak Creek, maybe this is to Alderman Kurkowski, but would the city of Oak Creek, if they get the money, utilize some of that to help beef up the staff at the health department to help with some of this stuff that needs to be done?
So I can say, so we have received some of the first couple of the funding packages that came out. Some of that was filtered down through the state and will be available to local health departments to use over the next year. And so that's potential for using that funding if we needed to fund additional staff. I know that the city has also been able to or will be able to access some of that funding for, the city has a lot of lost revenue and a lot of additional costs during this crisis, unfortunately, and Alderman Kukowski can speak to that. So some of the funding is also will be used to offset some of those revenue losses and increased expenses as well.
Well, yeah, this is Steve. There's a unified EOC, the Emergency Operations Center, and the local EOC has been activated. I know part of that process is Bridget, the assistant city administrator and the finance director. She is keeping track of expenses as best as she can with the information she gets. But any money that the city's going to get or apply for, it'll be between probably Darcy, Bridget, Andrew, and we'll probably know after the fact. I mean, we'll probably find out what's happening or what's being requested, but we won't know until after the fact. I mean, us, the council won't know.
Just one other quick question, Darcy. I know that some communities are starting. I know Milwaukee County is, Kenosha County will also be doing this, doing contact tracing. Is that going to be the responsibility of our health department to do that? Or are you going to, and when would you feel that it'd be appropriate to activate the Weaver volunteers?
Mm-hmm. So, I know that the state has been using Weaver for a variety of activities. So they reached out to, so Weaver, I guess I should know what it stands for, but it's basically a registry of public health volunteers, healthcare volunteers that can, might be willing to volunteer their time in a public health or healthcare emergency. So the state used that list to find staffing for the alternate care facilities that have been stood up. There was one at State Fair Park, and they've done some of those around the state. They have mentioned possibly using that list of Weaver volunteers for some of these mass testing sites, reaching out to see if they might be interested. And certainly as a local health department, if we needed to, we could reach out to our Weaver volunteers as well. The challenge with that is that a lot of them are currently employed health professionals, and so they're needed in where they actually work. So, you might be a Weaver volunteer, Jose, but you might not be able to volunteer your time right now because you are working at your other job. But as far as contact tracing goes, across the state, there's a lot of consensus amongst the health departments that contact tracing, which is the process of reaching out to individuals who might have had contact with someone who tested positive to inform them that they're a contact, explain signs and symptoms, and ask them to quarantine in their home, and then monitor their condition over that quarantine period, which is typically 14 days. We find that really works best when it's done at the local health department level. Those residents live in our communities, and so we're familiar with, the places that they might have gone. If we need to do business notifications, we're familiar with the neighborhoods. We're familiar with resources that are available to assist them if they need them during that time. The other option is really having those contact tracers located as state employees. And so they might be living anywhere across the state, just doing contact tracing by phone. And we've just found there is some of that going on now, especially assisting the City of Milwaukee Health Department, who has a very large number of cases that they haven't been able to manage with their staffing, but it just doesn't work as well because they're not familiar with the community and the neighborhood and the resources. And they're just not able to track down people as easily or connect them with what they need. So we've really been strongly advocating for the staff to use the funding that they have for contact tracers and giving that to the health departments to hire additional staff in our departments, and haven't received the state has not fleshed out that plan fully, I guess, to know what it will look like yet.
Well, but I'm glad that at least, there's a conversation going on. Mm-hmm. And I think anybody else, because we probably should move along, unless Darcy, you have something else.
No, I'm happy to take more questions.
Okay.
Otherwise, I believe the guest might have questions on this topic.
If we have a guest who'd like to ask a question.
Hello, can you hear me?
Yes, we can.
All right. On the Hispanic and the nationality, all people coming out of South America, whether they're Italian or Spanish, are considered Spanish. So that might clear you up on that question. I've got some questions on when is the city going to take some action in regard to masks at all businesses, perhaps in the community, and employees wearing masks, and temperature testing of employees at all city buildings. I've got some more questions, and I'd like to give them all to you, and then perhaps you can answer. I think that the temperatures need to be taken on when people come into work and again when they leave. At the end of the day, we know that temperatures tend to spike at 4 in the afternoon, so someone might come in and clean in the morning, but we catch them in late when they're leaving. I'm also concerned with the lack of inspections by the sanitarian. And if we had a mask rule in effect for the community, which we can implement, then our sanitarian could be doing inspections, especially of places like the food carryout. Let's see. I straightened out the data, but why are we always so late? It's my understanding that the state releases the information on new cases and deaths at 2 in the afternoon, but sometimes we're not getting it until way late. And then I want to know if we have any cases in private residential and how many, and also if there are any employees that have tested positive for COVID. Can someone answer?
So the city has started the process of, all of the city buildings have been closed to the public. So we have started the process of talking about the reopening, how that will go and what types of materials or policies or precautions will be put into place. So we have not made those decisions yet about what will be required of employees. That's an administrative decision that we're working on together. So I can't answer yet what will be required of employees or asked of employees.
But Darcy, right now, we have employees coming from all different walks of life into the city, and some may be breaking social quarantine or social distancing. So for the protection of all the employees, I really do think that it behooves the city to pass some testing. And do we have the thermometers?
So those would be decisions that the administration would have to make. Certainly employees are allowed to wear masks if they choose to. At this point, it hasn't been required, and that's a decision that would be made again by the administration if they were going to move towards a requirement.
I thought that would be your responsibility as Director of Health under emergency government.
Sure. We all consult on those decisions, but at the end of the day, the policy decisions regarding city employees are made by administration or HR, not by me. So regarding the data, you're right that the state typically puts out the data at 2 p.m. They are occasionally after that 2 p.m. And then I work with our communications person to get that data to her and to update our daily report. It's typically posted on our Facebook page as well as our health department website anywhere between 3 and 4 p.m., which is fairly soon after that data is released. Certainly we are all very busy right now and do our best to get it up there as soon as possible. We do get data posted every day. And we will not and do not release information about the location of individuals who test positive.
I'm not asking for the location. I'm asking if we have any private residential homes with COVID.
I'm not sure.
No, I would like to chime in on that, and that is a violation of privacy. And that is not anything that is...
That is not a violation of privacy.
Yes, ma'am, it is.
Because I'm not asking if Jose Avila has COVID or asking to be identified in any manner. I just want to know if we have any cases in private residential homes.
Do you mean a private residential home like your home that you would own, or I'm not sure exactly what
Right.
you're asking?
Exactly.
Sure. I mean, everyone who tests positive in Oak Creek lives somewhere in Oak Creek. So some of them live in homes, some of them, apartment complexes or condos.
Yes, but do we have any cases in private residential homes?
I think that's been asked and answered. It's going to be obvious for Rosemary if you've got so many cases of residents living from Oak Creek that test positive, then it only goes to reason
Everybody that
those,
everybody who lives in Oak Creek is considered a resident of Oak Creek. I'm asking specifically if we have any cases in private residential homes.
Yes.
Yes. Can you reveal how many?
I don't have that number. I mean,
I would think everybody's living in a home, so that
Right.
all the cases.
yeah.
you'd
How
be
many
in a home.
positive
But some
cases?
people are living in an apartment, some people are living in assisted living, some people are living in a group home. And these
So-
types of,
I think
so far our caseload appears to be more in the residential area or in apartments, not necessarily in the residential homes.
So please, what is your point?
I wanted to know if we had any in residential. Darcy answered that question with an affirmative. And then I wanted to know how many, but she didn't know that answer.
I
Well, how
think
many
it's
people?
I think it's irrelative. I think it's argumentative, and I don't think it's necessary to know the exact amount, Rosemary. Just assume that
I
yes,
don't think that your opinion is valid at this time, Mr. Kurkowski.
I
I'm
think what I'd like to do is move
part
on
of the board,
to
Rosemary. I can
the,
say anything I want to, like you can. Okay.
And I am a resident, and on my public time to speak, I have a right, and not to be heckled by the alderman to the board.
I'm not heckling you. I'm countering your accusations that you're not getting the information you think you deserve. You've been given the answer to your question. We should move on. We should move on from this.
It was
question.
incomplete answer.
All right, then please, ma'am, please submit your question in writing, and then they can respond to it. But we need to proceed on with the meeting.
Thank
I'd
you.
like to move on to the environmental health updates, please.
All right, yeah, this is Dale. I know to answer Rosemary's question too, I know about inspections. I haven't been doing any since the middle of March, any routine inspections, but as far as restaurants go, there won't be anything that's overdue until August. So essentially I'm caught up with the restaurant inspections based on one inspection per year that's required. So that part is okay. And with the summer coming up here, I got pools that are going to be opening up, assuming that they're going to be allowed to open up. In fact, I was just at one this week, a new pool at Orchard Hills. They're gearing up to get that thing open, but I haven't licensed them yet. So other than that, I had two new places that opened up, or Tropical Smoothie last month, and there's a Crispy and Grill that'll open up next week. So the two new places. And then during this last month and a half, roughly about 25% of the restaurants have not been open and operating to some capacity as far as curbside takeout or so about 25% have been closed totally. So, but I expect once everything opens up that most of them will be back in operation. So.
Dale, this is Steve. Have you had any complaints from anybody about any of the curbside pickup or to-go places that you followed up on?
No, not lately. No, initially there was a Jersey Mike's complaint. To tell you the truth, I don't even remember what it was about. And that's the only one that really comes out that I remember. Otherwise, no, since the middle of April, I haven't had anything. So.
Okay, and I understand that inspections across the board have been kind of not taken a priority because of everything that's going on. So if you were to receive a complaint, you would go out and deal with it, correct?
Yeah, well, typically what I would do is either email or call.
Okay.
If it can be done over the phone or email. And that's what I did with the Jersey Mike. And that was the easiest way to handle that one. So unless it was something really food related, at this point, I'm not too concerned as far as how the restaurants are operating, because they know the ramifications. You know, if they have an issue with people getting sick, that they're going to be, and they're taking, from what I heard from some of the operators, they're taking their extra precautions, you know, making sure employees are not sick, doing the extra hand washing and wearing those gloves and stuff. So they're taking this more serious to operate properly. Let's put it that way.
Thank you.
Anything else, Dale?
Oh, nope, that's it.
No. All right. Let's proceed on to old business. Anybody old business? Probably no new business other than what we talked about.
No.
And I think that, well, I just, on the record, I'd like to thank Darcy and her staff for everything that they do. And I'm so glad that you're here. And I don't know what we would do without you. Thank you for doing that. I do watch the City of Milwaukee updates, and I know usually one of the health officers is featured there, and they talk about how everyone is working collaboratively and as a team to ensure that everything is done as it should be and everyone knows what everyone else is doing and that you are sharing resources. So thank you for that.
Thanks.
And also too, please tell the staff, the nurses and the staff at Happy Nurses Week from us. And is there anything that we can do for you to support you and your staff? I could bring you donuts and Kringle, but if you want, but anything we can do.
No, I don't think so. I appreciate the recognition and the thanks, and I will certainly pass that on to the team.
Right.
And
And
Jose, can I add
Yes,
one
sir.
thing? I just want to say something with regards to what the city is doing with regards to reopening or anything like that. It is not a one-person decision with regards to anything that happens in the city. If there is a need to have a procedure that affects employees, that is going to be handled by the city administrator and HR. When the city decided that it was time to reopen the recycling yard, it was not well, let's just open it. Ted Johnson was consulted, and they worked together to come up with a plan to safely reopen that. So if there's concerns that certain employees need to be wearing certain equipment or temperatures need to be taken and you know, employees are coming in and out like that, then if Darcy feels the need, she'll consult with the city administrator and anybody else who's relevant to that area and come up with a plan. We don't have a one person rules all policy in this city. We talked briefly about thinking about reopening City Hall and the city buildings, but you have to come up with a safe way to do it. And I think it can be done, but they have to come up with some safe parameters to do so. It's not just going to be unlock the door and come on in and life goes on. So, you know, I didn't want to engage in an argument with Rosemarie, but that's the way Darcy's going to do it. I mean, she just isn't going to sit there and create edicts and say we're going to do that. I mean, we don't do it that way in Oak Creek. So I think you would agree with that, Darcy. That okay. So I just want everybody to understand that that's how business is conducted. Okay, that's it. Thank you.
And I also want to reiterate or echo that in the sense that, you know, if you listen to the City of Milwaukee updates and or the Milwaukee County updates, they do talk about working collaboratively and how everyone has to be on board with it. Everyone has to be agreeable to it. It's not just all of a sudden somebody shows up with a thermometer and say you can't come in. But something to keep in mind is that if and when we do start to do that, that will take some resources that we may need somewhere else into that position, i.e. that may take a nurse away from the health department where they could be utilized for something else. Not that this isn't important, but with the limited number of resources that we have, I think it is judicious to ensure that everything else is covered as it should be, and then let's include these other things. And it may become a priority in the future. It may become something that is more prevalently done or more frequently done. But then that would have been planned out, that would have been allocated, that would have been addressed, so that we do it, and we do it not like all of a sudden, well, you have to do this now. It's something that's planned out. So I do appreciate the fact that our city government does collaborate and does ask each other to make sure that things are working, because that's the only way. Go ahead.
Yeah, and if Rosemary or any other citizen in this city or business owner has a concern or a suggestion or anything like that, if it is sent to whomever they feel they should send it to, it'll get run up the chain of command, and it will get discussed. And it may not be discussed at that person's wants and wishes, or feeling that it should have gone further, but they'll talk about it. And that's it. I mean, we just don't do things because somebody wants it done. Everything is checked out first. Okay, I'm done. I lost audio here.
Anybody else? Any comments? Anyone? That other than our next meeting is scheduled for Thursday, July 2nd at 4 p.m. They will let us know if it will be in person or online. And I guess anyone have any questions that, feel free to go to the Oak Creek City website, submit your questions to the health department. They're more than happy to read them over and address them for you. But also keep in mind that, with as busy as they are, they may not get back to you right away. So if no one else has any other business, I'd like to entertain a motion to adjourn.
I have one thing I want to say. This is
Yes,
Denise.
ma'am.
I just want to say that I'm proud to be a resident of Oak Creek, and I'm proud to be on the board.
Thank you so much. We're
And I'm
happy to
happy
have
with
you.
everything that you guys are doing. So that's all I
Mhm.
wanted to say.
Yeah, I echo that. Anyone else? Otherwise, I will entertain a motion to adjourn. Did I hear Gary?
I'll start a motion to adjourn.
Okay, a second. Thank you, Denise. All in favor?
Aye.
Opposed?
Aye.
Abstentions? Thanks everybody for coming. Please take care, stay safe, stay healthy, and happy Nurses Week, happy Teachers Week, happy Healthcare Provider Week. Thanks everybody. Have a good evening.
Bye-bye.
Ready?
Bye.
Bye-bye. Bye.